Hello, my name is Carol Himmelgarn, and I am the program director for the Executive Masters in Clinical Quality, Safety, and Leadership at Georgetown University. Welcome to our information session today. So I want to start by grounding us all in just sort of the basics of patient safety and quality. In 1999, To Err is Human came out, and it's sort of the landmark study or the information around patient safety. And rarely do you find a paper written that does not cite this work. And what it did is it brought to the forefront that healthcare isn't always really safe. And in this literature, it brought up the different areas that needed to be improved and what those recommendations are, what we could do to improve healthcare. So when you look at Cherish Human, it was more the quantitative side, the harder science side. On the flip side of that came out was a book written by Rosemary Gibson called The Wall of Silence. This was the human side, the qualitative side. This book was the first time that patient and family stories were put out in the public that talked about the harm either they encountered or a loved one. So it's important to have the balance of these two because we need to connect the heart and the head when it comes to patient safety. So delving back a little bit more to the landmark work into Err is Human, we have to ask ourselves, have we gotten safer since that came out in 1999? Well, over the years, various people in the field of patient safety have gone back and sort of done a review to say, where we have improved and haven't. So 5 years after Terror's Human, Lucian Leib and Don Berwick came out and they said, okay, we've made some strides, but we've not really hit all the recommendations like we should have. But again, it's 5 years out and we know things don't change quickly. 10 years out, then, Dr. Wachter came out and he actually said, I'm going to grade where we are. So it's now 5 years past 2004 when Lucian Leib and Don Berwick did it, 10 years since the original report. And he said, we're at about a B minus. While we've improved in hospital-acquired infections and medication safety, we're still not where we should be. Hence, roughly now 20 years later, David Bates and Hardeep Singh have done the same thing. The reason I point this out is because that's why programs like this are important. We've not reached where we need to be with patient safety and quality, and there's always room for improvement. Sad to say, and many people don't realize this, is that medical errors are the third leading cause of death. Now, 2020 was an anomaly year because COVID was actually in the third spot. But other than that, traditionally medical errors have been. So again, 1999, we looked and we heard that anywhere from 44 to 98,000 people lose their lives a year to medical error. Well, at that point in time, shocking. No one could believe that. There have been a couple other very substantial studies in the early 2000s that said, that number is probably more around 250,000 people that lose their life a year to medical errors. So the question is, why isn't the public in an uproar? Well, because when medical errors happen, you have a few that happen over here in this hospital and a few down the road at this one and some in the neighboring states. People don't see it in one big conglomerated number. If it's affected you, you realize the importance of it. So that's why years ago, people in the patient safety field tried to provide an analogy. And it looks like this. The number of lives lost to patient safety errors or medical errors would be like 3 jumbo 747 aircrafts crashing roughly a week for a year. So think about that. The public would not stand for that like they don't for airline crashes, but people just don't know how many lives are lost a year due to medical errors. So if we stay with that theme of the airplanes crashing and aviation, aviation has done an amazing job being a safe industry. Now, they weren't always there. They evolved, they learned how they needed to do it to make flying as safe as it could be, just like nuclear power or railroads. If you look at the opposite end, where healthcare is, you can see the risk of being harmed in healthcare. And to me, I find it a little uncomfortable or disconcerting to realize that we're in the same column as bungee jumping. So healthcare is trying to become a more reliable organization, or what we call high reliability, but we still have a lot of opportunity for improvement. So what do we need to do? Well, in safety, we need to think differently. We need to have multiple viewpoints, looking at it through multiple different lenses. We need to be thinking about it in the frame of safety science. But the other thing that is so important is that we realize that patient safety, quality, and leadership are linked. If you're going to be a leader, you need to support safety and quality. And if you want to see improvement in safety and quality, you have to have leadership, your C-suite that is going to put resources, time, and manpower behind improving the care and the quality for your patients. So I want to talk a little bit about the program. We have two aspects of our program at Georgetown. The first is we have a full master's program, and the second a certificate. Let me talk first about our master's program. There are two options in our program. You can do a 16-month course and be done, which is full-time, or you can go part-time. Both ways that you want to go through the program are online or asynchronous. However, we do bring in some guest lectures, faculty have faculty hours. We try to make it, if people do want a little higher touch, that option is there as well, but it is not mandatory. We have 8 courses that go consecutively. You are only ever taking one course at one time. So when we talk about our capstone project, that is longitudinal, you take a course and then the week after you have your capstone. So you're never taking 2 classes at one time. The other nice thing that we have is we have 2-track option. At the end of the program, you can decide if you want to take your last 2 courses as what we call our traditional track, or veer off and take a human factors track. The other great thing is during the course 505, you actually come to Georgetown University, and we have a 3-day on-site, which is mandatory, but it's a great opportunity to finally engage with your cohort in person and also get to know some of the faculty that you've had classes with. You can see our program is about $50,000, and we do have scholarship opportunities. For the, so let's stick with the master's program. Our courses, 501 is our introduction to patient safety and quality, and this is just the basics about patient safety. How did we get here? Like, what's the history of patient safety? What are things like high reliability, patient engagement, and patient safety? It's just the patient safety fundamentals. The second course sort of takes you through the process of, like, what happens if there's an error? So what's the importance of reporting? How are you right at the bedside caring for the patient, caring for the providers and the team? What does a cause analysis look like? What are the different tools behind that? What's the communication after the harm? So it follows you through a whole thing of when harm transpires. The third course is a very unique because it's our quality improvement methods, and we collaborate with NACU in using their material for quality. And what's the beauty of this course is it's their material plus our academic rigor. And when you are finished with this course, if you want to sit for the CPQS exam, you are ready to do that. So you can also get that certificate. Our 504 course is around leadership, and is taught by a chief medical officer who used to practice in a large hospital, so understands leadership well. 505 is our on-site, it's our communication course, because we realize one of the top sentinel event reasons is because of communication breakdown. So it's really important that we understand the role communication plays in quality and patient safety. And when you're going through those, again, the capstone follows after each of those courses. Our 2 tracks, 506 is about policy, regulation, and economics. Anyone looking into being a leader in an organization, it's really important to understand how those play and that they're ever changing. 507 is about sustainable change. If you're going to lead in an organization, you have to be able to know, how do you get people to change and how do you sustain that change? Our human factors track, the first course is around core principles. And in this, you're learning things about what is the cognitive side, of healthcare and how people think. What are the ergonomics, all of those different principles in human factors. And then the next course is, what's that application? How do you actually implement a lot of those strategies in your organization? So that's our master's track. Our certificate is very similar. For the patient safety and quality certificate, it is the exact first 3 courses in the master's. And if you decided you wanted to take the leadership track, it is the first 2 courses, and then it's that 504 leadership course. And if you're going to do the certificate, you do need to take those 3 courses in order, and there's no breaks. It's a full time if you're doing the certificate. Our program is 6-week courses. So it's nice because then you get some breaks in between each of the courses. To wrap up, I just want to tell you a little bit about our student mix, career opportunities, and our faculty. So our student mix, as you can see on this slide, is very diverse. We have people in the program that are researchers, physicians, nurses, PharmDs. We have patient advocates that come through our program. We have a mix of military, people from a variety of different institutions. We have risk managers. So it's a very eclectic mix. And we like that because that makes the conversations richer and you're learning from a variety of different perspectives. When it comes to career development, you can see where some of our people have come through the program and have gotten new job opportunities, that they're in leadership positions directing quality of safety. They're chief safety officers, chief quality officers, directors of high reliability. Some have gone on to be consultants or have moved up in leadership roles in risk management. So there's many different opportunities to enhance your career by taking the master's or the certificate. And I have to say that we have some of the best faculty out there. We have physicians, nurses, we have PhD, we have patient advocates, we have quality improvement. We have physicians that are cardiothoracic surgeons and anesthesiologists. We have some of the top leaders in human factors with PhDs. We have people that are head of quality and safety at a major hospital system. So our faculty are people that are either frontline working doing this or have been in these positions, that they can help develop you as leaders and be mentors to you for your career if you're looking to move in different areas in the patient safety and quality space. Thank you so much for your time. If you have any questions, please feel free to reach out to myself, Carol Hemmelgarn, or the program coordinator, Jackie Stark. We hope one day that we will see you in one of our cohorts. Thank you again.